Good afternoon, members and representatives from Medicaid. Before we begin, I'd like to introduce the members of this committee. We'll go ahead and start with my far left. You're right. We have Representative Leila Stafford. She is the chairwoman for education. To her right, we have Representative Christina Sablan. She's the chairwoman for health and welfare. Next to her, we have Representative Ed Broke. He is the chair for gaming. And to his right is Representative Sheila Babalka, the chair for natural resources. To my far right, we have Representative Richard Lizama, the chair for PUTC. To his left, we have Representative Patrick St. Nicholas representing Tinian. And to his left, we have Representative Anita Yanktamai, the chair for commerce and tourism and cannabis. Next to her, we have Representative Vicente Camacho, the chair for federal foreign affairs. I am Donald Mangonia, the chair for Ways and Means, and then joining us shortly is the chair for JGO, Representative Selena Babalta, and our floor leader, Representative Ralph Humo. And assisting the committee is the LB staff. Here in PIC, we have the legislative assistant, Giovanni Taitano, along with Cameron Nicholas. And then we have our fiscal analyst, Mr. Dave Lamapon, our legal counsel, Joe Tyrone, and our IT personnel, Jonathan Diaz. So good afternoon, members. Again, we are gathered here today to discuss the Commonwealth Medicaid Agency's budget request, along with the governor's proposal on the general fund allocation, as well as the American Rescue Plan proposal. From what we have here, it looks like the governor did propose actually more than what the agency had requested, but we'll use this time to allow the representatives from Medicaid to explain their submission, along with any additional requests that was missed or something that they would like for the committee to consider. And so with that, we welcome you, and please state your name for the record and who you're with. Thank you.
Chairman Lonia, Vice Chair Blanco is not here, and members of Ways and Means Committee. My name is Annie Regis. I'm the MES Compliance Manager for the Medicaid Office. I have here with me Ms. Vicente Rosario. She is our claims examiner for the Medicaid program. Unfortunately, Ms. Sablan is not able to attend due to health emergencies, so I will be reading her oral testimony today. Thank you for the opportunity to provide my oral testimony on the Commonwealth Medicaid Agency, also known as the Medicaid program, for the budget proposed to the administration for fiscal year 2022. The Medicaid program will only summarize the budgetary requirements since there are too many details to cover in the time allotted for oral testimony. Further, the CMA has provided a comprehensive workshop and would be happy to do so again to explain the details of the required budget. The Medicaid program is a federal state territory health insurance program for low-income families. The program determines the eligibility and enrolls the eligible individuals or families into the Medicaid or Children's Health Insurance program. For every dollar for the program, the costs are shared between federal and territory government as provided for in Title 19 and Title 20 of the Social Security Act. The percentage of the federal state territory contribution is the Federal Matching Assistance Percentage, also known as the FMAP. As you are aware from previous testimony, the financing of the Medicaid program and reimbursement for medical services went through several historic periods of federal funding. From 1978 to 2009, all administration and healthcare service expenses were funded at a federal and state share of 50-50. and the federal contributions are capped through Section 1108. The Section 1108 caps simply do not cover the medical services required by the beneficiaries. The CMA expended $54 million in fiscal year 2018, and the cap for the year were approximately $7 million, or 13% of the total expenditures. In 2010, under the Affordable Care Act, the Cnmi received an increase of $101 million to spend between 2012 and September 30 of 2019. Further, the federal share was increased to 55% federal, and territory share was decreased to 45%. For fiscal years 2020 and 2021, under the further Consolidated Appropriations Act FY 2020, the federal share was increased to 83% and the cap increased to $60 million. The U.S. Congress added further increase in the amounts through the following: the Family First Corona Response Act, given the public health emergency, U.S. Public Law 116-127, and the Consolidated Appropriations Act fiscal year 2021 provided additional $3.1 million increased by FMAP, which increased the FMAP by 6.2 and provided other relief. In December 21, 2020, U.S. Congress passed Public Law 116-127 that enables nationals under the Compact of Free Association residing in the Cnmi to be eligible for the Medicaid program. Medicaid and CHIP program have several major components where the federal and territory governments share the expenses. Medicaid administration under Business Unit 1951. The program expenses for administration are shared 50 federal and 50 territory. The Medicaid administration expenses includes general program administration, management, and program operations. Medicaid payments for medical reimbursement to provider under Business Unit 1980. The program expenses are for payments to medical service providers, including the hospital, other primary and specialty care, ancillary services, laboratory, imaging, pharmaceutical, transportation, and other services that are specified in the Cnmi Medicaid state plan that must be approved by the Centers for Medicare and Medicaid Services. When a beneficiary receives medical and healthcare services for an enrolled provider, the Medicaid program then reviews the claims and pays the provider in the amount determined by the CMA and the CMS, as provided for in the Cnmi State Plan Amendment. The amount provided to providers are shared by the federal and territory government. Compliance and Medicaid Enterprise System under Business Unit 1981. The CMA has not complied with numerous federal requirements that other states comply with. The CMA is aware of these requirements, and the compliance and MES budget is required to comply and to make reasonable and appropriate progress to meet the statutory and regulatory rules. Compliance and MES have substantive and extensive process and documentation requirements. Some MES components have associated penalties that reduce federal funding. Most of the program activities are currently funded at 90/10. The projected budget requirement for the Cnmi appropriations for FY 2022 are as follows. For program administration, $350,000, medical reimbursement, $5.5 million, compliance and Medicaid enterprise, $510,000. A total ask would be, for local, is $6.3 million. This budget assumes that the U.S. Congress will appropriate the same level of funding as for fiscal year 2020 and 2021. Enable the federal matching assistance percentage of 83% to continue, or eliminate the caps and enable the FMAP to be calculated in the same way as the states for the territories. The worst case scenario is that the U.S. Congress does not pass either the two options above. The worst case scenario, the Cnmi government would need to fund over $50 million in Cnmi general revenue funding, or the CMA would eliminate the eligibility of beneficiaries and or limit coverage for health care services that program is able to provide. If the worst case scenario materializes, all healthcare providers, especially the Commonwealth Healthcare Corporation, would be severely impacted. The CHCC, as a safety net provider, would have to continue to provide services with drastically reduced funding. The CHCC for fiscal year 2021 is currently receiving about $32 million in Medicaid funding. The CMA, as you are aware, is working hard to meet all compliance and MES requirements. The amount of work is massive. The CMA is continuing to make systemic progress in the areas and will continue to do so. In summary, the funding requirements for the Medicaid program will be dependent on decisions made by the U.S. Congress. The Commonwealth Medicaid Agency is requesting matching funds based on the best case scenario. Should the Congress not continue the level and matching percentage that currently exists, the Medicaid program will immediately return to the Cnmi policymakers, since important decisions will need to be made on whether there are local funds that may cover the shortfall of $50+ million, or whether the policymakers will cut beneficiaries or services. The CMA went through this very excruciating and painful exercise in 2018 and 2019. The CMA further requests that the House Appropriations Committee include the clause to enable the Medicaid director to shift funds between these categories. A bill has been introduced in the House to codify this authority, given the need for reprogramming, since there are and will always be the CMS program activities funded throughout any fiscal year. Please appropriate the funding that is required. Thank you very much for the opportunity to provide this testimony. Please let me know or our program know if you would like to have further details. Thank you.
Thank you, Ms. Reyes and Ms. Borja, for coming in today and for sharing the director's requests along with several information that would be beneficial to the committee. In regards to your request, I know we mentioned this earlier off the record, but for the members and to bring it in record, currently this fiscal year, CMA was given 13 FTEs, and then just recently through House Joint Resolution, Representative Staffler requested an additional 16 for a total of 29 FTEs. But your submission only indicates 25 FTEs, and so you would need the additional 4 to meet the current FTEs allotted this fiscal year, correct?
That's correct.
All right, and just for the members' information, so on page 2 of your packet that you provided, you listed the projected budget requirements at a total of $6.36 million. Can you elaborate on what this additional $38 million coming from the ARPA would do for the medical reimbursement?
Is it okay if I have the sentence?
Yes.
Okay, this was just one scenario. What we submitted in the budget package for FY22 was based on FY21 and also not including the amended payments we're making to CHCC for the rest of FY21, which was just recently passed, and it also does not include the COFA. So this is just one projection. As of right now, for FY22, CMA is only gonna receive $7.1 million in federal at 4555. If US Congress doesn't pass Kilili's bill, the HR 265, which will lift the cap but does not fix the FMAP. So the budget FY22 submission packet is based on if they lift the cap.
Thank you. Thank you. I recognize Dave Navon.
Thank you, Mr. Chairman. Just for clarification, so you're saying that this option that we're looking at right now, approximately 6.3 million, is the worst case scenario?
No, that's the best case scenario.
So the one that you submitted as requested of 39.2 million is the best case scenario?
No. We have updates because when we prepared the budget packet, that did not include the amended payments to CHCC and it didn't include the COFA. So now we need more money.
All right, so which one do you prefer, the 39.2 million or the 6.3 million?
Right now we're at 69 million.
No, on your request.
On our request, so in our request, we need more.
So that's what I'm saying, which scenario you're preferring, because based on your submission, you're asking from the governor's side.
From the governor's side, that's what we needed at the time, but as of right now, today, we need about $69 million.
69 million.
And that's without the assistance from the federal.
I see. So actually, how much do you need altogether?
Worst case scenario is the $69 million.
69. So far we only have 43.3 million.
I'm sorry, can you repeat that?
So far we have 43.3 million funded out of the general fund of approximately 5.3 million, and the ARPA money of approximately 38 million.
Yes, we did not count the ARPA money because we weren't aware of it until now.
So when we do the math,
then you
yes. Approximately 10 million you need on top of what you're asking.
More like 20.
So just to kind of give a little brief, so the confusion of the 70 million is the worst case scenario, just in case we do not get any actions made on the US Congress side. So we are going to be down from on the FMAP for the section 1108 will be down to
61.2 during the public health emergency, 55 without the public health emergency.
Yeah, so right now, the projection here on this document is the best case scenario, which if US Congress passes, but the worst case scenario is the 70 million. When we submitted the budget, we were still in conversation with the US Congress delegates in Katie Sablon's office to kind of, address the averting of the territorial funding for the lifting of the caps and the, the FMAP. However, when we had submitted that, it was just based out of what we would end up returning back to in reality if we didn't have any of those things passed. So that excludes also the COFA money that we had not received. And then at that time, I guess US Congress was still deciding whether the COFA national should be also be included or be eligible for the Medicaid program. So that's where also the additional money from what we're asking for if US Congress does not pass is at 70 million, if that makes sense.
So if it's passed, what's that figure, the actual figure, 48? What you've submitted?
If the US Congress passes Kilili's HR 265 bill, it lifts the cap, which means we can ask for as much money as we need. So based on our expenditures for FY19 and 20, we expend about $59 million, but that's not including administrative and not including COFA.
Trying to understand this. So
there's a lot
with the inclusion of COFA alone, do you know what that cost would come out?
Okay, so our COFA, based on CHCC data only, we're expecting about $11 million a year, but that's just the start. Whatever 1108 federal matching is, COFA's matching. So we revert to 4555, COFA reverts to 4555 as well. And if that's the case, then COFA alone, local share is like $9 million. But that's just to cover COFA.
Any further clarification?
Thank you. Dave?
Just for one more round. We have money from the federal side for Medicaid and also for the insurance, for the children insurance.
Mm-hmm.
Would that supplement your request?
Based on what I just saw for 38 million and the 4 million from local, we need more. If nothing happens in the US Congress.
So when you say more, how much you're talking about?
So 38, 42 less 70, about 20 plus million more.
Okay, because right now, as we speak, we have approximately $43.3 million available for your office. As we speak, it's a combination of ARPA money of approximately 38 million, and then the general fund is putting out approximately 5.3 million. So that's where we get that $43.3 million.
Okay, so we
on top
still
of that,
yeah,
we still need
about 20 more million.
20 additional, aside of what you...
Aside from what was already in the governor's proposal?
No, aside of the additional funding that you will be receiving from the federal side, because we have some federal money.
Our federal, what we're expecting for FY22, if nothing happens in US Congress, is only 7.1 million.
So what's that federal budget that we have from the governor for the Medicaid office for? Do you know that?
The ARPA money you're talking about?
No, the federal money. Let me read it out for you.
Sorry, I think what he's asking is about the request that we submitted. So on that part, that was a projection of how much we will not be able to receive back with the 60 million. So if we revert back on the section 1108 monies, it will be back to about 7.1 million. And then for the reimbursement side, it will be around 6.7 million. So that shortfall alone, an average for fiscal 2019 and 2020, we've projected to spend about 53 plus million in funding. So that does not also include the COFA. So that 53 million that we spent for fiscal year 2019 and 2020, that's the average. 53 million plus the 9 million that we are now considering to include because of COFA. And then that 5 million would be administrative. So we're almost looking at about 70 plus million. But you were mentioning that if we have the ARPA, because we have the ARPA, which is the 4.3, then we'll probably be needing only about 20 to 28 million, somewhere around roughly at that amount.
We're trying to establish here now is the funding that you want us to appropriate for you. And so far, based on what we have, there's two funding sources that we have that is available for Medicaid, which is from the ARPA, approximately 38 million, from the general fund, of 5.3 million, total 43.3 million.
Correct.
On top of that, we have some funding here from the federal government that was submitted by the governor for the Medicaid office.
Yes.
And it says here approximately 37.1 million for Medicaid assistance program. Are you aware of that?
No,
So
this is just new
that's what
to
we're
us.
referring to. Yeah.
Okay, this is just new to us.
And then there's another one here, says Children Health Insurance Program, approximately $9.9 million. So altogether, we're talking approximately $47 million.
I'm sorry, what law is that?
No, this is the budget, federal budget money coming from the governor.
I know,
That includes the ARPA, correct?
No,
Is that
ARPA is on
separate?
the other side.
Oh,
ARPA is on the other side.
okay.
ARPA is taken separately from this funding source. So altogether, we'll be getting more than 70 million.
Okay,
So then we don't need any more.
that would be adequate.
No, we're trying to figure this out, so I just want to clarify that.
Thank you,
Yeah.
thank you.
Yeah, no, we're not aware of
We
that.
didn't know about the other additional 40 plus.
Chairman,
Dave, can you pull that funding source under volume 2?
Okay. Would you?
So I'll give you time, and then we'll go ahead and open the floor to the members. But before I move on, if you're saying that your average expenditure is around 59 million or 50 some million, why is it that your submission is at 39 million?
Like I mentioned earlier, when we prepared the budget packet for the 38 or 39 million dollars, that did not account for COFA, and it was also just a guess if nothing happened in U.S. Congress.
No, but okay. So what happened the last 2 years where your expenditures were at 59 million without any U.S.
We
funding?
got, so the further consolidated Appropriations Act of 2020 appropriated the U.S. territory $60 million for 2020 and 2021. That ends this September. Come October 1st, we're back to 7.1.
Okay. Okay, I get it. All right, members, while we give Mr. Demapan time to pull up the report, the floor, I would like to open the floor, and I recognize Representative Sablan.
thank you, Mr. Chairman, and welcome, Ms. Regis and Ms. Warhub. I think it would be helpful, now that you do have this additional information, to submit a revision, a revised budget request, because I think all the numbers that are going back and forth here are quite confusing. And while we do get that this is an evolving situation, just I think last week, Congressman Kilili announced that his request for the inclusion of insular area Medicaid was granted in the President's fiscal year 2022 proposal, and that includes both eliminating Medicaid funding caps for the territories and aligning the matching rate with the states. And, and then as you know, HR 265 is moving through the process. So, I think there is reason to be optimistic that there will be congressional action. And, I think for our purposes, so that we can better understand what local funds are needed and how ARPA funds could supplement Medicaid's needs in this upcoming fiscal year, I think it would be really helpful to have a revised budget request from you. If that makes sense, Mr. Chairman.
Yeah, and I agree, but yeah, so until we see what Mr. Demapan is talking about, we can, this would be new information to CMA, and we'll give the agency time to review this information, and we can come back and at a later time. So with that, I hand over the floor to Mr. Demapan.
All right, so the information is on the screen right now, and as you can see there, you can see under Medicaid, right? There's Medicaid Assistance Program activity there, and it's showing a total budget of 37.1 million. That's quite wide.
Can you scroll? Can you scroll down?
Enlarge.
Right.
Yeah.
And scroll down.
Can we get that printed?
Or is it okay if we just go to the screen and just look at it?
Yeah, please.
Sorry. I need a magnifying glass.
Come on over.
Turn it off? Some more?
Some more.
Okay.
Okay.
That's better, no?
Can you see okay?
Left foot.
Left foot, all right.
You see the plus and minus, you can actually notice it.
Yeah, we can zoom.
Back a little bit.
Yeah.
Zoom out.
One step. No, left.
Knows the mouse.
There you
Yeah.
go.
All
Thank
right.
you.
That's the
So
one.
37.
That's the one that was submitted by the governor under volume number 2.
Okay.
And so there are two activities there. Medical assistance program of 37.1 million approximately, and then the other one for the children's insurance of
Okay.
9.9 million. So we're looking at 47 million approximately.
In addition,
Yeah, in addition.
what's on the right, the last column? What is that?
Which one is that?
So
What is the
so
last
can you just
column?
explain a little bit about this table versus this table?
That's for FY 2021.
Oh, okay. And then
Sorry.
this one is for FY
Yeah,
2022.
Yes.
So right now, it's showing here that it's 36.3 million
Right.
is what is appropriated to the Medicaid office.
Yeah.
Does this include the ARPA funding, or is this
No, that's
Okay,
that's-
so this is
fiscal
local.
year. No,
local,
it's federal.
federal?
So I think it should be better if we verify this information from the governor's office, the OMD, whether this funding is designated specifically for Medicaid, just to be sure. But this
Well,
is
then
coming
I
out
would
from the governor's
appreciate
office.
But what's the funding source? They're saying it's
Yeah.
federal, but if if CMA doesn't know what the funding source is, then what is the basis for this?
So there's two kinds, right? There's the volume 1 and 2 or 3.
Right.
So the one that I saw online was one would be federal, one would be local. So right now you're projecting this one to be at the federal side.
This is volume 2.
Okay. So then now my question is, on the local side, how much are we receiving?
The
That's what I'm
4,
saying.
or the 5.3.
Just 5
And then on volume 4 is the 38 million.
in addition to this.
In addition to volume 2,
Okay.
which is that.
Okay, so now that's making sense. So 36, 43,
No,
and
36
5.
is this fiscal year.
Oh, this fiscal year.
The middle column or the first column with the figures, that's for next fiscal year.
So this would be from federal.
Yes.
That's for federal.
Can you scroll up a little bit?
Oh, you see the title of the table?
The title of
Just scroll up.
Yeah, just scroll up a little.
We're using his fingers as the mouse because he's
Don't
Yeah,
click
they
the
are.
F.
Afraid of PDF.
Don't click the F.
So that's 22?
Yeah, and that's 20.
Okay,
Okay.
so disregard that one. This is federal, 47 million. And then for fiscal year 2022, for the local budget, that's 5 point
Something.
5.3.
some
And
million.
then we also have ARPA money.
And then the ARPA money is how much again? I'm sorry.
About
38.
38 million.
So that computes a total of 90.5 million for fiscal year 2020.
So we
So the question is this also ARPA money?
No.
no.
Oh,
Yeah, so
so
there.
where's this money coming from? I just want to ask. Because
That's coming from the federal.
Maybe that's the best case scenario for the governor's office.
Yeah, maybe we
But
can
I feel
also.
like you guys should know. And like,
this is what we.
where did they come up with those numbers? We should confirm that with OMB.
Yeah, but even with the current fiscal year, there's a 33 million, or what's the goal? Can you hype that up? Dave, can you hype that
Right, the bar, the
bar?
sidebar.
Alright.
Just click.
Just,
Click.
Cam, can you
Just press the button.
close the?
Yeah, just click.
Close out of that. Get rid of that. Take this out. Move that. Yeah.
Yeah, so there's a 36 million bring up bill. Ms. Regis,
Yes.
does that 36 million bring a bill for this fiscal year
For
from federal funds?
I mean, if that's what we're receiving, we don't recall having to receive the 37 point some million.
What are you on track to receive this year?
So right now, if there's no movement on the US Congress side, we're looking at about reverting back, so 7.1 million, and then the 17 million that we're receiving from the.
But that's for the next fiscal year.
Yeah.
But for
For
basically
this
this
fiscal year?
2021.
Right now, we're at 4, we don't get.
But what have you received so far from the federal?
Oh, federal? 77.
So
Yeah.
well over this amount. So
Yes.
this was what they were projecting in the beginning, right?
Mhm.
Yeah. Yeah.
Yeah, that 80, almost 90 million would be sufficient if there's no passage on the US Congress side. But if there is some passage, then that 6.6 is our best case scenario to ask.
Okay,
That's why in the last summary, I did mention that if that $6.6 million is not available to us, I mean, if it's 6.6 only, and we need more, we will come back and ask. But right now, we're just keeping it at a point where we're hopeful that US Congress would have something for us. So rather than over asking, we'll come back again at a later time if there are funds available to fund the Medicaid program.
Okay.
I hope that helps. Sorry for the confusion, because we didn't know that there was about 90 million.
all right, members. So, Ms. Regis, again, going back to what Mr. Dimapon shed some light on, that is volume 2. You can find it at around page 5 of volume 2. So just to recap, under volume 1, which is the general fund and the governor's proposal, CMA is expected to receive 5.3 million. Under volume 2, again, which was just discovered, is Dave goes at around 47 million. And then volume 4, which is the ARPA, the governor had proposed 38 million. So that computes a total of about 90.5 million for fiscal year 2022. Now, so unfortunately, S.A. Villagomez is not here today, but she has been attending some of our hearings. This is something that we can bring up with her to get further clarification on the additional funds that Mr. Demapan had brought up. But and so that we, while we give you and the members time to review this new information, should you have any questions or would like to come to the committee again, we can schedule a hearing at a later time. But as of right now, members, if there's anything that you would like to ask in terms of the current administration of the CMA, I will open the floor to allow the members to ask any questions that they would like to. And so with that, the floor is now open. Is there none? Oh, I recognize Representative Salon.
Yeah, thank you. I just wanted to get a little more clarification on how this very recent COFA approval will impact Medicaid for the current fiscal year and for the upcoming budget year.
Well, CMS actually provided funding for the COFA nationals at $11 million. If let's say that we don't receive any changes in US Congress, then we'll have to go back to the 45-55 share. We will then need the 9 million
Okay.
in local funds.
Right. But at the current FMAP rate then, the Cnmi share for the COFA for the COFA monies that we're receiving is what?
For this fiscal year, 89.2.
No, I mean the Cnmi share, right now it's 80.
Oh, so the
83.
percentage for that would be 10 point,
Oh, the local share.
10.8 local share.
The local share is 10.8.
Yes, and we
Okay.
were given 6 million for this fiscal year.
Okay. And then the 11 million is for the next
fiscal year.
Okay. And then you mentioned the wanting reprogramming authority for the director, and there I understand that language is already in the bill that I think Rep. Staffler introduced. And I think that in the event that that isn't signed into law before the next fiscal year, we could include it as an administrative provision as it was done in the previous budget act to allow the director to have that greater reprogramming power. But could you just explain, I think, in greater detail, the need to be able to move money between MES and admin and Medicaid reimbursements? Is that how is that reprogramming power, I guess, necessary and exercised?
Well, I can explain for the 1108, the regular admin. Our 1108 funding includes admin. So we take out money from our federal for reimbursement and put it in admin. The local has to come with it also.
Okay.
So it's one account.
Okay.
Divided into reimbursement and admin.
Okay. Okay.
Did that make sense?
I mean, yeah, I guess I just wanted to understand, like why it was so necessary.
So if we ask for 300,000 now for administrative payment, it's taken out of the 1108 funding.
Okay.
If we happen to be short, we can ask for more, but it'll come out of the 1108 reimbursement.
Okay.
It'll be transferred to admin.
Okay, and that flexibility has been
She has the flexibility for federal
this year. Okay. Okay. And then my final question on presumptive eligibility, do you have any updates about how much longer that is anticipated to continue?
Not at the moment. It just depends whether the DHHS will terminate. So it depends on
So the current termination date is
the end of the public health emergency.
Okay. But
so there's no end date. As soon as the announcement is made by the DHHS, that's when it gets terminated. But we are given, I believe, ample time, I think end of the month.
Yeah.
Once the announcement is made.
I see. But what did your budget submission presume in terms of presumptive eligibility?
It's paid under the 1108 funding. So there's no separate.
So the 60 million that was given to us is also in addition to how much we're using for to pay for reimbursements under the presumptive eligibility beneficiaries.
Okay.
And then that extra 3.1 million that we did mention was the money that was provided by under the coronavirus act.
Right. Okay. Okay. Yeah. So, I mean, you would expect that once presumptive eligibility ends, if it does end in this next fiscal year, that Medicaid enrollment will drop dramatically, right?
So there's some people that may actually be covered under COPA from the presumptive eligibility.
Okay.
Right now, it does not discriminate on the citizenship. So anyone that is also a contract worker can also apply for that, given that they meet the income criteria.
Okay. Okay. Thank you. I yield, Mr. Chairman.
Thank you, Rep. Sablon. Sorry, before I pass the floor over to Rep. Abata, can you maybe, if you don't have that information available now, maybe send it to the committee at a later time. But if you can share with us what the positions are for those 4 personnel that you'll be needing, that way we can adjust it on our.
Sure, I'll provide that once we get back to the office.
Okay, thank you. I will now recognize Rep. Abata.
Thank you, Mr. Chairman, and thank you, Ms. Regis and Borja, for being here. My first question is regarding the cap, and thank you for providing background information about the cap. And I know that we're all just trying to better understand the Medicaid program, so that's the purpose of my question. It seems like we go over our cap consistently, and you provided information, for example, in FY 2018, the cap was 7 million, but we expended 54 million. And so for fiscal year 2020/2021, the cap was increased to 60 million. Have we gone over that cap already?
No.
No? Are there concerns?
So how we got our money in the prior to FY 2020 was through the Affordable Care Act, which we were appropriated a little over 100 million to expend over 10 years, more or less.
Right?
So that's where the extra income, extra funding was coming from.
I see. I see.
The 7.1 million is our flat, our flat yearly grant for the territory. Oh, our.
Okay, and the House bill in US Congress 265, we're hoping to lift the cap.
Yes.
That we don't have a cap anymore.
Correct.
Right, okay, understood. And then my second question is in regards to your MES, compliance and Medicaid enterprise systems. You did state that the CMA has not complied with numerous federal requirements that other states comply with. And we are required to make reasonable and appropriate progress to meet the statutory and regulatory rules because there are associated penalties that reduce federal funding. Can you just expand on what our reasonable and appropriate progress has been?
So there were several things that we've been able to make. I'm not sure if you guys are aware, I'm actually the only one in the program. That's the reason why the House Joint Resolution was requested, is to also fund for additional staffing to help me and Medicaid, expand, because they gave us 60 million. We asked to be treated like the states. They gave us the money. Now they're requiring for us to meet several requirements within the for the Consolidated Appropriations Act. So we've done thus far some. We've been able to at least get the implementation planning advanced planning document that was approved by the CMS, which is actually funding our program at 9010. We've also have a unified program integrity contractor, which is contracted by the CMS. That's one of the reasonable and appropriate progress that we've been making. In addition to that, we have also, we're kind of working on this whole eligibility, enrollment, reporting to TMSIS, but that's not going to take just one person to do it. So we've been making some progress along the lines. So we appreciate the House for passing the House Joint Resolution to at least give us the adequate FTEs to be able to meet these requirements. So thank you for that.
Thank you, and thank you for sharing that.
Oh, sorry, to include that as well. In one of the provisions for the Public Law 116-94, we had to designate a program integrity lead, which is also my role. In addition to that, there is also in future, we're going to have a conversation to request to have a Medicaid fraud control unit as part of the funding that was given to us under the further Consolidated Appropriations Act. So that's also a progress.
Thank you. Are you, Mr. Chairman?
All right, I recognize Representative Lizama.
Thank you, Chairman. Thank you for the information you give us. It was concerned presumptive eligibility for contract worker. Oh, you don't know the numbers, correct?
So as of March 15, 2020, based on what was provided by the CHCC, presumptive eligibility enrollment went up to 17,000.
And there's still more because they're not aware of this program per se.
I believe there are a lot of people, they call their office to try and apply, but CHCC has been designated as the entity to actually determine eligibility for the presumptive eligibles.
So can you, is this also in the budget? And it's already predicted that we want to have many people coming?
Quite not sure because we don't know what's gonna come next year.
If public health emergency ends, presumptive eligibility goes away. That's basically it, and we won't be having to ask for additional funding on that side. However, that's where also with the COFA request that we've gotten, we got the 11 million, but if we don't have anything from the US Congress, we'll go back to asking the 9 million. But it seems like there's enough. We just need the clarification to really see if that really 90 million is given to the Medicaid office.
So one more question.
Sure.
A person with the contract worker and is eligible, and if it's not registered, he can go to hospital and say, I'm this and that, get the information.
They have to attest. They have to attest on income. We don't.
Right.
Yeah.
But they can do it at the hospital at a base where they, as they are safe, and they have not applied. Can they do that?
No, they cannot receive, I mean, the hospital does not turn away patients, that's for sure.
Emergencies, yeah.
But to my knowledge, in order for you to avail of the services like the health insurance service or payments that will be made by Medicaid, you have to apply with the CHCC for presumptive eligibility, as long as they meet the income criteria.
Okay.
Because in Medicaid, our regular Medicaid is income and resource for our US citizens. And now COFA.
Thank you. Are you?
All right, members, if there's any, we'll take one more, and then if the members would like to call Medicaid in again at a later time, we can certainly do so. Again, because of the new information that we were made aware of. And so with that, would anyone, I open the floor to one more member. I recognize Representative Yanktamaya.
Just one very simple question, but maybe not everyone knows. COFA, what does it stand for?
Compact of Free Association.
Okay, so that would be FSM,
Correct. Yeah.
Marshalls? No?
Yes, that's correct.
Okay, that's all, thank you.
Okay, you're welcome.
All right, thank you, Representative Yanktamai. And so with that, members, this concludes our budget hearing with the Medicaid office. Again, thank you, Ms. Regis and Ms. Borja for filling in. Please extend our well wishes to Director Sablan.
Thank you.
And so with that, again, the committee, we're expecting the additional positions for the 4 FTEs, their titles, and we will also get clarification with OMB in regards to Volume 2, as well as we'll give you time to review that Volume 2 as well. And should the members have any additional questions, we'll schedule another hearing. And so again, thank you for coming in. If there's anything that you would like to say in closing, I hand the floor over.
So on behalf of Medicaid, we really appreciate all the support that you have given us. Thank you for listening, not just to us, but also our community that really needs the healthcare services. So with that, thank you. We really appreciate it again.
Thank you for all you do.
Thank you.
Thank you again. All right, members, moving on to the next item on the agenda. Public comments. Anyone from the public would like to make any comment in regards to today's budget here? If none, we move on to announcement. We can save the next announcement for the next hearing, but we do have NMC up next. And so we'll take about a 5-minute break after we adjourn to allow NMC to get settled in. So with that, the next item on the agenda is adjournment. Can I get a motion?
Second.
Alright, motion was made and seconded. All in favor, say aye.
Aye.
All opposed, say nay. This budget hearing is now adjourned.